everyone. Welcome back. This is Dr. Sumit Grover, your clinical psychologist or your life coach or mentor, whatever you want to come to me. Today, I have a special guest with me, and that is Dr. Rupali Virk. She works as a clinical psychologist and she has her own practice in a city in northern India, that is Chandigarh. And me and Dr. Virk, we met each other in a conference recently, which we attended. And we started talking about how things work as far as psychiatry and psychology is concerned in India. And we touch based many cases of common cases which we get of anxiety disorders or even geriatric or even a transgender issue or a homosexual issue. So today I invited her with me on my channel so that we can have an open live discussion with in front of you all. So I'll hand over to Dr. Virk. Dr. Virk, welcome here to our channel and to our kind of a virtual studio, whatever you want to call.
Thank you, Sumit. Hi, everyone. As introduced, myself, Dr. Rupali Virk, and I am a practicing psychologist in Mohali. This is a tri-city, actually, Sumit, Chandigarh, Mohali, and Panchkula. So I am working from Mohali, and I am handling various concerns, as mentioned by Sumit. Sumit, the question which you asked about the system, the
Yes,
kind of
we were talking about system when we met.
yes.
So my question was that out here, the way it works is that we all have a primary care physician or a family doctor. So whenever we have any kind of an issue, whether it's a mental health or a physical issue, we go to our family doctor or a primary care physician, and then they refer to us to other professionals, trained professionals who can deal with your problem. So how does the system work there? Like if, for example, if a child is going through some school anxiety or bullying or social anxiety and is having panic attacks, so how does it work here? Do they have to contact on your own, or is it that some professionals contact you and refer them to you?
Sumit, like here in our place, it's not that the government hospitals are referring the cases to us. It's basically the school teachers or the parents. So they search us online and then they approach us. But now people are very aware and they're very open to that. So they don't mind coming for counseling and psychotherapy. Some schools, they already have tie-ups with various counselors and psychologists. That is a positive thing. And another point important, I think, which I want to mention here is that every school here has a counselor.
Oh, good to know that because I am pretty old school. I left India around 25 years back when I joined University of Canterbury to complete my further clinical training in psychology to be a clinical psychologist. At that time, going to a psychiatrist or a psychologist was a very big social stigma. In Hindi, they used to say a very standard line, "मैं कोई पागल थोड़ी हूँ." That means I am not crazy that I have to go to a psychiatrist. So that is what was happening 25 years back. But really good to know that openness is coming and all the things which were pushed under the rug came up in a good way. So, what kind of anxiety disorder cases had you been handling, or you handle, or you treat, Dr. Virk?
So, any age group, I have seen that anxiety, panic attacks, stress, depression, these are the most common concerns, which come to us for consultation. Uh, Generally, it can be generalized anxiety disorder, and in some cases, it is specific anxiety related, concerns also. Like sometimes I have seen that parents, they have too many expectations from their child. So in that case, I have seen that manifesting in terms of examination anxiety or repetition.
Internalizing, yeah, internalizing.
Yes, because parents want too much from their children. these days.
Not
They're
only
all,
parents out here, it's, I think there, this is something which really matches, even if the cultural differences are there. Because you see, human beings are human beings. We all have same mind, same feelings, same emotions. Individual differences are, of course, there. So even if there's a big cultural difference, but the what you are talking about, it's not only expectations of parents which can be more, but it's also expectations from oneself, which leads to some conclusions. I am not good enough. I won't be able to do this. By no means I can handle this. So when this kind of thought process or thinking starts with the patient or with children, then obviously it is going to lead to anxiety or depression. So good to know that there are some commonalities here. But anything which you think out here, how does it work with, as far as transgender or lesbian or gay or homosexual cases? Is it still under the table? Because out here, since past many years, there were many states, including New York State, where I live, that legal marriage is allowed between people with the same gender. So out here, it's becoming little open. Some it's under the table, but some it's open. But I have gone through many cases in which 14-year-old or a 12-year-old, just during puberty or after puberty, they realize that something is different, and they want to belong to transgender, or they're bisexual and they're homosexual. So they get anxious and depressed because it's hard for them to express to their parents, and then the family comes to me for some discussions. So how does it work with this sensitive topic there in India, or especially in northern India at present?
although there is a mindset change, but still I think people are little concerned. They are not very openly accepting it, though there is a change, I'm not denying that. But very few cases I have worked on related to homosexuality and all that. And I think one most important point which I want to mention here, I mean, till the time somebody himself or herself is accepting that thing, you know, how can they expect others to accept that?
Yeah, yeah, it lies, you have to respect yourself the way you are made, the way God, universe, creator, whomsoever we believe in, has made you, right? We have to accept that, and then only things can be better. But is there a kind of a difference between openness in a small city and big metropolitan cities like Mumbai, Delhi? And is it a difference because of the cities too, and because of culture? Because in small cities, it's a pretty close net, very closeness among the neighborhood, and they're very close net. But in cities like Mumbai, we don't even know who's living next to you, right? So does that also matter because of declaring oneself as homosexual?
Yes, yes, this I have noticed because the place where I am in, this is also a very small town. So people know each other. So here, maybe very few people are openly accepting, but when it comes to metropolitan cities like Delhi, Mumbai, I am sure people are more open to that.
How do you feel advertising yourself? That are you having a transgender issue, are you having a homosexual issue, or finding hard to declare or respect yourself with this? Contact me, I can support you with that. So are you yourself comfortable to advertise yourself that way, or still it's counted as a little bit of a social stigma and you don't want to advertise?
Yes, there is a social stigma attached to it,
Right.
Sumit. We are not very openly highlighting that issue. That is there.
But
Yeah.
talking to you, it seems to me, when I even talked to you before, that you are a pretty daring woman. So just do it, because we have to capture this, right, for the society. So well done. You're doing a great job here. Let's talk about some other cases of social anxiety and bullying. Anything, it's very common there too. 16 years of age, sweet love, puppy love is leading to many issues and bullying and self harming or suicidal thoughts or something like that still? Or kids are more pragmatic now or practical?
Uh, See, adolescent age group is the same, Sumit. like we were when we were growing up. It's still the same. I work on so many cases where they get into those infatuation modes, and they feel that their whole life depends on this person. And it's more due to social media also. So they make friends, and then if something like this happens, something negative happens in their relationship, and then yes, they are upset. Then they seek counseling also for that. Then you have to work with them. Adolescents are the same.
Are the same, yeah. But I, when I see my nieces and nephews now, oh my God, what a change. 25 years back, I remember when I had my first boyfriend at a young age, it was a blow in the family. It was a tornado or a storm in the family which came, because it was not acceptable at all. But now these days, I think parents are also more comfortable, and because they don't want any issues or divorces happening if they get married, so they themselves say, you know what, you go and find your partner on your own. We don't want to find for you, because we don't know how it's going to work with you and your job and your perspective. But during our times, they said, no, you are not finding a person for yourself. You have no clue what you will get into. We are going to find a person for you, and we will do arranged marriages. I remember, but now with my nieces and nephew, I see, oh my God, it is such a difference. And it's become a kind of a fashion. You need to have a boyfriend or a girlfriend, otherwise you are counted as what are you counted as? What is the word which they use? Adolescent, you are counted buddhu, right? Like, you are not counted as a smart person if you don't have a partner, right?
See, there is a shift. I mean, you are right. Parents are more accepting now. So I mean, they are accepting their adolescents. And it's just that they tell them that few things happen with time. This
Yeah.
is what they use as a.
Evolution, because that's what I was talking to one of my other psychologists. She's my colleague, Dr. Janine Ippolito. We work together in the practice since past 12 years now. So we were talking about this, that when we were 2 years of age, we didn't even know how to handle use our fingers for computers, and there were no iPhones were not there. Nowadays, 2 years of age, both the hands they're using on the phone, and they're clicking and they're playing video games and stuff, as if they've come out of the stomach of the mother, of the womb of the mother, all well trained. This is evolution, I think, right? Correct?
They're smarter than us, Sumit.
Yeah, they are smarter than us, and they are more pragmatic also than us. They're more
Yes.
practical. So
They very clearly know. They know what they want actually.
what their
They're very
emotional
comfortable.
mind.
They're very comfortable in their skin.
Yes, very comfortable in the skin, and also their emotional mind, and also their pragmatic mind, reasonable mind, and leads to a good, reasonable, rational decisions. Because, but moreover, you know what, during our time, we didn't even had internet, we didn't had any laptops, we didn't had any phone. We learned from the books. We had
Yes.
to go to the library to explore the world. From the library and from the teaching of the geography, we came to know, oh, there's a country known as America, oh, there's a country known as Norway, which is in Scandinavia. But nowadays, Google,
Click of
Google is Google, and Google Doctor. It has made things very different, right? Good. Well,
one point. I think that this one aspect, getting everything at the click of mouse, I think that is leading to in lack of patience and tolerance also,
not
which.
only about self-diagnosis. In my
Yes.
case, you will laugh at it. One of the patient comes to me and with his wife, and he tells me that, Dr. Grover, I think I don't know what kind of personality disorder he used. I did a test on the computer, and I think I have this kind of a syndrome and this personality disorder. I said, excuse me, and you need to diagnose me with that. I said, you know what? I can't diagnose you through Google. Okay. We have DSM-5 and ICD-10 psychiatrist manual. I can diagnose you with a certain personality disorder only which are given there. Okay, show me the book and let me see. I said, here we go. So I gave the big book to the wife and to the patient and to the person. And then they opened, oh, so this is the list of person. I said, yes. So we are only allowed to diagnose you if it comes under the umbrella or meets the criteria of these personalities. I cannot by any means diagnose you with a stock syndrome or a Q syndrome personality or Q personality disorder. We don't have that in our manual, right? So it's becoming a little harder and more harder.
Now because they find everything on Google, so I get so many cases related to health anxiety also,
Mhm.
because little knowledge is dangerous. They just see the symptoms and then they match it with themselves, and then they feel, all the symptoms are there in me, ma'am.
Mhm.
Is it that I'm suffering from this issue?
Oh, yes, yes.
Then you have to then you have to again take the help of DSM-5R.
No,
But
because
see,
out here the problem is where even I use MMPI-2 for personality testing and MMPI-3. The problem here is that if the question is saying most of the time you are feeling that way, the patient declares yes because they must have felt that couple of times in their life. So when I ask them most, not most, but twice I did in the past 10 years, but then read the question, it says most of the time. So that's where the intervening of a professional is needed to explain the question to them what they're asking, right? Because if they're going to check these questions which they are not even feeling for a certain time. But anyhow, good to know that. But I have couple of more things to discuss if we can, if you permit me with time. One of them is that dialective behavior therapy and mindfulness skills, keeping your mind, body, and yourself into a mind body balance and physical sensation balance, which has, of course, come up from yoga and meditation. So now, how is it working in India? Are we welcoming a new psychological form of dialective behavior therapy of mindfulness, which is a little kind of maneuvering of yoga and meditation skills, or are we not welcoming it?
Sumit, yes, in most of my cases, I use an eclectic approach. So, combining the mindfulness techniques, relaxation therapy, and even the cognitive behavior therapies.
Hmm.
So, in combination, we work with the cases,
Good.
because then you see a positive result.
So the
I Being
more
aware of your concerns, being aware of your thoughts, being aware of the moment, that is very important if you want to handle your concerns. So this actually we use
Yeah,
in our practice.
that is what the personality disorders are, that they think differently, they feel emotions differently, and they behave differently, right? So, out here, you're talking about being in the moment and keeping a balance and knowing what you are thinking, acting on your thinking, the behavior, and knowing what you're feeling that causes a balance in a mind and body of a human being. Good. But I really feel proud of myself when living here abroad, when people are going more towards meditation, yoga, mindfulness, and I'm an Indian here, and I also attend a yoga online class with my yogi teacher, Jitendra Kaushik. He's a very good teacher, and I'm doing online yoga with him 3 days in a week since past 2 years. It changed my life. So I feel very proud to be an Indian here. That yes, yoga was invented and meditation that was an Indian concept, right? Okay, so I love that. I love that concept. One thing more I want to talk to you about. How are the geriatric services there for older people, 65 and above? So, is it that they also are approaching you for some therapy, or the psychiatrist MD for some medication to prescribers, or for them, okay, we have lived a life, we don't want to go to any psychiatrist or psychologist. How are geriatric services as far as psychiatry is concerned going on there?
Sumit, they do come for counseling and psychotherapy. They do go for psychiatric intervention also. Like I mentioned earlier, if the concern is at the mild or moderate level, then they approach me,
Hmm.
and it's beautifully handled together as a team. But if the concern is at a higher level, maybe the severe level, then I refer them for psychiatric uh, consultation further. But they are more open to counseling and psychotherapy, like all other age groups, because it's not that the life is ending. You have to live each day.
Yeah,
You
you
have to.
have to live each day, and you're living for yourself. You're not living for living
Yes,
for others, right? You have to
yes,
be any person who's not, even if a person 65 and above and 70, 75, living in an extended family, in an
yes,
extended family system, if they are not happy, and then how can they make their environment and others happy? So you have to be happy first, then only you can make others happy. It's a very common thing when we travel in a plane. They say that before putting the mask, oxygen mask, to the person sitting next to you, you have to put it on yourself, right? So that's the way it works. Well, but yes, because at the end of the day, all what matters is you matter, your life matters, right? That's the bullet point, and that's why we all approach to mental health professionals and physical body health professionals. It's high time that we should stop counting it as a social stigma. Well, it was great to talk to you, Dr. Virk. Looking at the time, I understand. I'm so sorry we went a little bit over time, but it was great to talk to you. We will come up with further discussions, and we can be in touch with each other, email each other, and come and discuss cases. And maybe in one of the another podcast, we can discuss some cases and sensitive cases too, and have some case studies for people, so that they can understand that what kind of treatments and how even psychotherapy and psychiatry is going through evolution, and we are exploring more, and we are supporting people more, and the community more than what we were in the old schools in 25 years back. Well, thank you very much for being here. So I'll let you all guys go. Thank you for listening to us. Do subscribe my channel by pressing the bell, and give a thumbs up if you like this podcast, and I will come back to you soon. Till then, cheers to you. Have a happy life. Cheers with coffee. Have a happy life. Have a wonderful life ahead, and have a good day or a good night. Bye.